important economic issue that's facing our nation today, and that's healthcare. We are here today to get input from local professionals and consumers on ways to fix our nation's broken healthcare system. As a pediatrician, I agreed to moderate this event because this is also the week designated Speak Now for Kids in Health Reform. So I'm here to speak for the children in my practice, the children of Iowa, and their parents. But today's discussion has been organized by a grassroots project of the Service Employees International Union. Since 2002, the year I happened to have run for Congress, a group named Iowans for Healthcare worked tirelessly to put healthcare reform at the top of the agenda for candidates running for political office. As a result, we've seen several healthcare candidates elected to office, from city to county positions all the way to the White House. This year, they're continuing their grassroots work for Iowa for healthcare with a new organization called Change That Works. With a strong coalition of over 35,000 healthcare voters here in Iowa, they've helped elect leaders who are ready to deliver meaningful healthcare reform to the millions of Americans who struggle every day with a high cost of coverage. Change That Works is organized throughout the state to make sure our elected officials in Washington deliver healthcare reform this year. The focus of the Change That Works campaign is reaching out to Iowa's senior Senator Chuck Grassley. He's the ranking member of the Senate Finance Committee, and that makes him a very key player in the healthcare debate. More importantly, Iowans are counting on him to deliver meaningful reform to our healthcare system. Senator Grassley's committee is already hard at work developing a new healthcare bill. Just this month, they've held 2 roundtable discussions. The first dealt with healthcare delivery, and the second, which was held this last Tuesday, May 5th, dealt with coverage. The suggestions we get here today from our visiting professionals and our attendees will be delivered to Senator Grassley's office this evening, given his vital role on this issue. And there's a mailbox right there. You can put your notes to Senator Grassley right in it. I would like at this time to take a moment to discuss the last roundtable discussion on expanding healthcare coverage. I happened to be in Washington on Tuesday, the 5th, and met with Senator Grassley in the afternoon along with several Cedar Rapids physicians. And one of the things he mentioned was that there is a growing consensus about the need to increase healthcare coverage. The devil is going to be in the details, but at least he recognized that there is a consensus for a need for increasing coverage. The second thing that is, I think, very important to him is quality. And I feel that the way that we can give a message to Senator Grassley is to say, we cannot have quality without coverage. And so I think that this is something that Senator Grassley is very open-minded about and is ready to listen to you, Iowans, who can tell him how important coverage is. The Senate Finance Committee did bring together leaders from across the political spectrum, from business, community, and insurance industry to labor and consumer groups. In fact, that seat in that roundtable was very, very hard to get. It was very hard to get into that forum. At the outset of the discussion, all the panelists were asked about whether there was a need for reform. And every single one agreed that there was a need for a significant reform of our healthcare system. The most heavily debated issue among the committee was whether or not to include a public plan as an option for Americans to buy into. On Tuesday, several of the panelists, members of the Finance Committee, did voice their support for the public option. There was a common theme. If we're going to provide meaningful healthcare choices to American people, offering a public plan option is absolutely critical. Simply put, if you like your current health insurance, you can keep it. But if you're one of the 47 million Americans without health insurance, or one of the millions more who are underinsured, then you will have the option of buying a plan like the one members of Congress receive. Just this past Sunday, the Des Moines Register reported that a majority of Iowans favor creating a public plan option. Also, 2/3 of Americans support this initiative, according to a survey by the Kaiser Family Foundation. In 2008, 1 in 6 United States metro areas were dominated by one health insurer and controlled 70% of HMO and PPO enrollees. Iowa is no different. We have a majority of enrollees in one insurance company. This leaves next to no room for consumer choice and provides limited competition. A public health insurance option coupled with a more structured and robust private insurance market will prevent a handful of companies from controlling the insurance market and can help drive down costs as well. With lower administrative costs and a more efficient public system, we can finally get healthcare costs under control. Just looking at our current system from 1997 to 2006, healthcare spending has grown 59% faster in the private sector than in the public plans, such public plans as Medicare. The bottom line is a public health insurance plan is a vital component of healthcare reform. In short, healthcare reform is moving full steam ahead. They expect the bill to be ready August 1st. Now is the time that our country should unite around providing quality, affordable healthcare coverage for every man, woman, and child in the United States. This is the year, and we need Senator Grassley to stand up and support a public health care option that will give Americans more choices and better care. Again, Senator Grassley is committed to quality health insurance care, quality care, health care, but we cannot have quality without coverage. So that's the message to Senator Grassley.